Oh. Hey, buddy.
Hey, Buddy. So that was my dog, Buddy.
What a way to start over our
Yeah.
sleepover. Buddy already fell asleep. Let's draw a mustache on him.
Did I ever tell you my dad does he calls them haircuts for his dogs? Have I told you this?
Maybe, and he dyes them.
Yeah, he puts shoe polish and he'll give them like mustaches, eyebrows, sideburns. Welcome to the podcast. Today we're talking about
EMDR therapy.
Yes. And what does that stand for? Eye movement desensitization and reprocessing therapy.
So we first found out about this on Secret Lives of Mormon Wives, which if you have not watched, Mikayla, one of the Mormon wives, has some trauma that she wishes to process. And so she's talking about going to EMDR therapy. And she goes to this therapy. And already they're talking about eye movement. So of course we're more interested, right? And then
so the thing that made me want to look it up is because we are in our 4th year of optometry school. We're not doing classes anymore at all. And I'd never heard of how eye movement can
we've never talked about
psychologically affect processing.
What also was intriguing to me is that when they showed her going to this therapy on the show, it just seemed, I don't want to say not real, but I was just really curious about how what they were doing could actually be working, because I want to recreate, for those that haven't seen, what happens on the show. And this is going to seem like I'm exaggerating, and it's not. She sits down with her therapist, and I'll be the therapist. And the therapist is basically, long story short, it was like, okay, we're going to talk about your trauma, and you're going to follow my finger with your eyes and talk about your trauma. And while you're moving your eyes, this is going to help you process it. And then she just goes like this. And she has her follow her finger with her eyes, and they talk about her trauma, and apparently that makes it go away, or something along those lines. Again, that's like very generic, but
and you watched the TikTok that said like that's not really.
Well, yeah, that was kind of another thing that I was like that seems crazy. Just, oh, follow my finger. Like, I was thinking she was going into some kind of like, I don't know, like VR, like, I don't know, there's like some binocular vision function stuff that we do that has like more intense testing like that. So that's what I thought she was going to have done. Not just go sit down in front of somebody that's going to do like half-assed EOM movement and say, follow my finger. But on TikTok, which is the source of all true knowledge, people say that that's not necessarily how it's always done, and that some of these EMDR therapists have like a light bar with a light that like smoothly moves back and forth that you like follow with your eyes, and it's not just some lady in a room that you follow her finger.
And maybe I'm just speaking of like I've already researched it, and that's the example that everyone gives is they just follow a finger or follow a target.
Yeah.
Right to left. And it's more about the rhythmic binocular stimulation of the brain.
You gotta bury it. Get rid of it, buddy.
I don't really see a difference between fingers and
that's
lights.
fair. Just like, if I'm gonna, go to therapy, I think I would be upset if, that was the solution a little bit. I will say though, this is a thought I'm just having right now, nothing that I've researched, and this is all just out of my own head. I haven't researched anything, because I never do. And it almost seems like kind of like hypnosis-ish.
Yeah.
It does. Have you ever been hypnotized?
No, I know you have.
I have a couple times.
Hypnotized right now.
Anyway,
Lauren's been hypnotized, and it did not help her in any way.
I was hypnotized for like a bit, like a comedy show, so yeah, frankly, more or less.
We should try to do it again. We should hire a hypnotist for New
Year's. No, okay, I've seen on TikTok people hiring magicians to come to their like adult birthday parties, and I think that's so fun.
I want to. So Josie's not going to watch the podcast. Josie? We have a friend named Josie. I hope she doesn't mind us saying her name.
I hope she watches.
We have a friend named Josie, which I don't think this is gonna come out until like her birthday. For her birthday, I want to get her a gloving starter kit because now that Instagram Reels, like, it shows things that people have liked. She's always liking gloving stuff. She loves that, eats it up. And so I either want to hire a gloving professional, which I'm not sure.
Maybe you could get a Cameo,
I don't know that she has
like a preferred.
like stars, like, but it's kind of more. As I was looking into it, it's more of a rave thing, and so I'm not sure that there are professional glovers.
Oh, I think you should get a gloving starter kit anyway,
Yeah.
regardless, because I think the thought of having to be in a social situation where you've hired somebody to come do that makes me personally want to cry.
Well, it would probably be at your house. So.
Yeah, I know.
Lauren's the only one of us that has a house.
Yeah, so everything happens at my house.
So anyway, gloving, lights, fingers, combination of the two, EMDR. What is it? So the American Psychological Association has defined it as a structured therapy that encourages the patient to briefly focus on the trauma memory while simultaneously experiencing bilateral stimulation, typically eye movements, which is associated with a reduction in the vividness and emotion associated with trauma memories. So I was really confused about that because we are taught if you cover one eye and you try to see something that's like a little bit hard to see, it is always going to be easier to see with both eyes. Pretty much all the time, unless there's like some sort of medical condition. And it's because, you're only using half your nerves, your seeing nerves, to
Right, like you
to view
have
this
like
object. And so if you double that,
three-dimensional
yes.
vision too, like you have depth perception with both eyes
Yeah.
that you don't have monocularly.
Yeah. And so I wasn't really sure how using both sides of the brain causes a reduction in vividness. So I really, really deep dived into,
I guess
bilateral stimulation.
the term vividness for me feels a little bit confusing because I feel like the vividness of an image that you're actively like seeing and processing feels different than the vividness in terms of memories feels different to me anyway. So I feel like some of that, again, with the no knowledge I have right now, feels like maybe just like a miscommunication.
Okay, I
But,
can see that.
I
just feel like all of those words in this official definition, I feel like they were very careful selecting those words. But yeah, that's true. But so basically how they described it is when you experience something traumatic, when you're processing that memory, it's like a roadblock happens in your brain. And EMDR therapy is supposed to kind of build a detour around that roadblock so that you can take that memory down to where it needs to be processed. There are two parts of the brain that are like the most important for EMDR therapy, and that is the amygdala, which triggers our fight and flight response, and the prefrontal cortex, which is responsible for inhibiting the amygdala.
Okay,
Is that too sciencey?
maybe. No, it's fine.
Okay.
I'm following.
Basically, when you experience a traumatic situation and you are unable to process that, every single time you think about the traumatic situation, it feels like you are experiencing it over again. So you have all the same physical responses as you did in the original moment. And that is what they think is from an overactive amygdala. So the prefrontal cortex, whatever memory, whatever neurons that need to be processed, blah, 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 it hasn't reached the prefrontal. And so the amygdala is just on overdrive.
This is with PTSD?
Yes.
Okay.
Any
or like traumatic.
Yeah, really any traumatic experience where you have an overactive response. EMDR therapy could help specifically because the amygdala is just overactive. Okay. EMDR therapy claims that bilateral stimulation calms the amygdala's overactive response. And it says that it does this by lots of different ways, but I thought the coolest way that it explained it was it compared itself to not it. People who do EMDR therapy compared it to REM sleep. So if you think about you're really mad at someone and you go to sleep and the next morning you wake up and you're kind of thinking about things a little bit more logically, you don't really remember the exact feelings you had right after. Maybe it'll take a few sleeps, few sessions. But for some reason, REM sleep makes us process memories and store them.
Mhm.
And so EMDR therapy is supposed to kind of mimic that.
But is REM sleep, the eye movements is not what is storing the memory, though.
No.
That just happens then. Because, like, if
Yeah.
you could just store memories or, like, move things through your mind with just moving your eyes back and forth, why are we doing that all the time?
Right. Yeah.
Why haven't I been studying with a light bar behind my notebook?
So this is, the parts of the brain that are involved when we just pursue. Specifically, I want to point to the caudate nucleus right in the center because this is the caudate nucleus, as I'm sure you don't remember like I did. And it's attached to the amygdala. It's attached to the amygdala.
Yeah, there it is.
So you can also see in eye movements, we are involving the prefrontal cortex. The thought is that with eye movements, as you are thinking about the trauma, you are building new neural processes, like from that amygdala area to the prefrontal cortex to quote unquote get around the roadblock. Does that kind of make sense?
Yeah, it does. You're kind of selling me on it. I don't know if you're trying to.
No, like, yeah, it works.
Yeah.
Right now, it's according to the American Psychology Association, it is like it's not a first line treatment for PTSD, but it is a second line treatment for PTSD.
I feel like just their like basic definition that we started with made it sound hokier than it is.
Yeah.
Like I think they need to just work on their definition because
Okay, at the end of this, I want to hear how you would redefine it.
no.
Because I mean, like you just can't get into the weeds.
Vividness, I think, is the problem.
Okay.
If the American
I mean, but
Psychology
I think-
Association is watching
I
this
think
podcast,
really what it does is you can't vividly remember these memories anymore. I couldn't find any randomized clinical trials for EMDR therapy proving its effects on the amygdala, but there is proof that REM sleep depotentiates the amygdala activity. So it calms down the amygdala. And if EMDR is similar to REM, then I think it's safe to assume that EMDR therapy can do the same thing. And there are clinical trials showing that it increases prefrontal control.
I will say, I feel like at the end of the day, regardless of whether or not there are clinical trials and stuff to back this up, it does seem like if it's helping people, like the mechanism of it necessarily. In this instance, it's not like we're putting people on, drugs that are going to have thousands of side effects and stuff. Like if this is helping people, like it's really like whatever, let them do it. Because like obviously there is some like neurological pathways and stuff that are correlated, but really something else that I was kind of thinking of as we're talking about it is like really how much of this is just it makes it easier for them to talk about trauma with kind of a distraction of keeping up those eye movements, and maybe that makes it easier for them to voice this trauma and just kind of getting it out in the open. I wonder if that is
so they did compare it to cognitive behavioral therapy, which was what they said 4 sessions of imaginal exposure, so describing the trauma, and 4 sessions of therapist assisted in vivo exposure, physically going to a disturbing location. Some studies said that EMDR therapy is equally as effective as cognitive behavioral therapy. So just like re-explaining your trauma, talking about it, getting it out in the open.
Like I think cognitive behavioral therapy is like what you would traditionally think of as therapy, like seeing a therapist, like, talking about your trauma, like process,
that's true. Yeah. There were some studies that said EMDR therapy is more effective. So like I said, the cognitive behavioral therapy, that's like 8 sessions. It can probably differ. I didn't really find anything like that. Honestly, I didn't look super into that.
Kind of hard to track too. Like that's got to be very like person by person.
On average, only 3 to 6 sessions were needed for EMDR if a patient had PTSD from a single event. If it was PTSD from multiple events, a different study from Kaiser Permanente found that with an average of 6 sessions, so still less than 8, about 3/4 of patients were in remission. They even talked about drug therapy, specifically with, I don't have it anymore. Fluoxetine, I think.
Yeah.
Yeah. Specifically with fluoxetine, these people believe that EMDR therapy was better because once EMDR therapy ended, patients continued to heal and continued to not experience their PTSD symptoms. And then as soon as fluoxetine
Was discontinued.
they
Like was
PTSD.
symptomatic again.
Yeah.
Yeah. That's what I'm saying. Like, I kind of feel like, really, with all things in medicine, I feel like if you can treat something without medication that comes with like side effects and costs, I feel like it's worth a shot. You know?
Even if it's just your therapist's finger, huh?
Yeah.
Your
Yeah.
tune is a little bit changed on Mikayla's therapist, huh?
Yeah, a little bit. Meh. Okay, because here's the other thing that I'm just like thinking about, and again, it's a reality TV show. They're probably not really gonna show her real therapy session, but
Yeah.
like I can understand how this would work if we're like processing through and like going back through your trauma, but that's not what they did. She was basically just like, it's been a while since I watched
Yeah.
it, to be fair too.
And they did say that the first part, like the first part of the first session, it's just regular questions. One site mentioned that they believe that the EMDR therapy helps patients associate their trauma with a better environment. So like the safe environment of the therapist's office. And so asking those questions first helps build trust. It can help like make you feel like it's a safe environment, make you feel like it's a non-threatening environment.
Yeah, okay.
Yeah.
That makes sense.
But it doesn't even have to be just eye movements. It can be like tapping, so like rhythmic tapping here and then on your left leg, right leg, left leg. I think that I would kill someone if they were doing that to me.
Really?
Yeah. For a whole hour?
Wow, okay. You don't like when you go to the dentist and they like tap your shoulder when they give you a shot?
Nobody's done that to
you?
me. Nobody's ever done that to me.
Is it because you don't have trauma at the dentist like me? You probably get numb the first time too, huh?
Yeah, I do.
You don't have the
Freaking right away. Yeah, and that's why I have mouth disease right now.
Right, veneers, blisters in your mouth.
It can also be auditory, rhythmic.
So like any kind of bilateral.
Any kind of bilateral stimulation.
Yeah, because that was going to be a good question of mine is what do you do if the patient does not have binocular vision? So we encounter that pretty often in our line of work.
I mean, right. As long as they can move both their eyes.
They don't have to have visual input?
I don't think so. I think it's more about the movement. Because that picture that I showed, it's just how to get the medial rectus
just the
and
pursuit.
lateral rectus to move.
I guess so.
Visual processing is a whole
other beast.
Yeah, 70% of your brain. Actually, that's not true. 70% of your sensory processing is visual. That's crazy. So that's kind of all I have about EMDR therapy.
That was really fun to talk about because I really came into this being like, this is someone.
No, yeah, me too.
Because I think I'm already in that headspace because we don't need to get into it, but I already feel weird about what Mormons believe.
Okay.
You know?
Yeah.
And so I'm already just like, oh God.
Yeah.
These Mormons, they're up
and it's
to it
hard
again.
Because that show has done a lot, not a lot. They've done some like experimental medical treatments.
Right, the
such as ketamine therapy. Yeah. So do you think you could give us a better definition than the American Psychological
Well, show me their definition again because I really only have problem with one word.
That's their definition.
Literally, they could just shorten it. You could say a structured therapy that encourages the patient to briefly focus on the trauma memory while simultaneously experiencing bilateral stimulation, typically eye movements, which is associated with a reduction in the associated trauma memories.
In the reduction of memories?
With a reduction, yeah.
I mean, but it's not reducing your memory.
Well,
it's more reducing the emotion.
Yeah, and
the vividness.
There's a reason that I'm eye doctor and not an English teacher.
Yeah. All right. Well, thanks for coming to our
science
Our
sleepover.
science sleepover.